The next question, the member for Scarborough-Guildwood.
Thank you, Speaker. I too want to welcome those from the Ontario Health Coalition who are packing the galleries today, including Michelle Jones from Scarborough. Michelle's grandmother is in long-term care, and both Michelle and her grandmother acquired COVID-19 in November. They believe from a resident who had visited the hospital for dialysis during an outbreak at the hospital. So much for the iron ring, says Michelle. Speaker, my question is to the Minister of Health. This government rolled out a vaccination plan that is not easy to use or accessible to all. The vaccine keen are finding their way, but we cannot over-rely on vax hunters to pick up the government's slack. There are people in Ontario who face systemic barriers to health every day. Where is the plan for the Ontarians who have systemic barriers to vaccination? Speaker, not everyone has a computer. They certainly cannot use a library computer during lockdown. Some people are vaccine hesitant or lack confidence in vaccines, and they certainly lack confidence in this government. What is the minister's plan to reach the people in Ontario who are eligible to get the vaccine but face systemic barriers to getting it? How will you track individuals and provide socio-economic data?
Thank you. Thank you. Minister of Health.
Thank you, Speaker, and thank you very much to the member for the question. We do have a comprehensive three-phase plan for our vaccine rollout. We are now in phase 2 of the plan, and I can advise that to date over 7.2 million vaccines have been delivered. We have over 5.3 million bookings for vaccines in the future. So clearly many people are finding their way through the system and aren't finding it that difficult to negotiate. But for those people who don't have a computer, they can also make calls to our online call centre and book their vaccines that way. And we also have numerous pharmacies that are offering vaccines, both Moderna and the Pfizer vaccines. People can make their own appointments through their own vaccine clinics at their pharmacies. So there are many ways for people to access these vaccines. We are making sure that anyone in Ontario who wants a vaccine will be able to get one.
And the supplementary question.
Thank you, Speaker. And back to the minister. As your government just said, it just takes one to ignite an outbreak. The Ontario Science Table said to prioritize hotspots for 4 weeks to save more lives. You said no. Hotspots have some of the most vulnerable people in our communities that have a high proportion of essential workers, and they have not seen 3 waves. They've actually just seen a tsunami of 1 wave continuously since the virus started last year. If the minister in this government is so confident in their plan, why not accept my request to collect socio-demographic data, including race, ethnicity, disabilities, languages spoken, so that we can better track who and where the vaccine is getting to? Tomorrow, I will provide amendments to Bill 283 at committee that will require the collection of race-based data and other important information collected when someone gets a vaccine, while protecting, of course, their privacy, which you require. And this will allow the government to see that this life-saving vaccine is truly equitably distributed. Speaker, will the minister fix her bill today and support these amendments so we can better track who is receiving the vaccine?
The Minister of Health.
Well, thank you. As the member will certainly know, we are tracking this socio-demographic information by asking people if they wish to disclose it or not. We are making the receipt of the vaccine subject to the person's individual choice, and I believe that the disclosure of this information should also be according to their own wishes and not be mandatory. Most people are providing it. Some people don't wish to. However, I can also speak to the issue about the hotspot areas. We did designate 50% of all of our vaccines going into hotspot areas for a 2-week period, with the result that we now have a 7.9% increase, higher increase in people receiving the vaccines in the hotspot areas than in the non-hotspot areas. So clearly that's working. But I can also advise that the Ontario Science Table recommendations presented in April assumed a rate of 100,000 vaccines administered per day on a 50% hotspot and 50% per population basis for 30 days. However, in the month of May, the province will receive approximately double the number of vaccines than were originally estimated by the Science Advisory Table, and we are confident that we will be able to roll out those vaccines in those hotspot areas to make sure that everyone who needs to be covered will be covered.
Thank you. The next question, the member for Sarnia-Lambton.